Hi, welcome to the channel. I'm Dr. Sylvia, a general practitioner and health educator with AskAwayHealth. I want us to have a little chat about BBL, Brazilian butt lift. And yes, this video is in the wake of the reports that another young girl has lost her life from this complications of this surgery. So I want us to have a talk about this. If you do a very small search on the internet, you will come across several videos that talk about the risks of this condition. So believe me, I'm not going to spend much time talking about the risks of this condition because I think that they are widely discussed on the internet. So if you are interested and if you are doing your due diligence as somebody who wants to have this procedure, there is no way you're not going to come across videos or commentary about people who've had BBLs and have had complications from BBLs. And I'll be very surprised if you don't even come across comments from specialists in countries where they have well-developed facilities and healthcare structures and healthcare infrastructure to look after people who've had the surgery, who encourage very, very strict regulation for those who are surgeons who are going to carry out the procedure, for potential patients or ladies who want to have this procedure, to do everything you can to check that the center you're going to have the operation, the surgeon who's going to provide the surgery, and your aftercare, to check and double check and triple check that they are the highest possible standards, highest possible levels of effectiveness, and so on. So that's not really the point of, that's not really why I wanted to do this video. I actually want to share one of these videos on the internet that you will come across right here on YouTube. I want to share this lady's story because she survived. And what I thought was interesting, and I'm going to highlight these in her video, I'm going to highlight her comments. She had complications, and despite having those complications, she said she'd do it again. And I know a lot of people commenting on the young lady who, by the way, I'm sorry I didn't give her name at the beginning, Destiny Jojo, may her soul rest in peace. A lot of people have commented on what drives our women, what drives women in this direction, particularly young girls. And I think, like many things in this life, when you're trying to find out the cause of these problems, it's not just one thing. There's always a mixture of different things. And so you can, to some extent, you can blame social media. To another extent, you can blame influencers who make it look as if, wow, it's fantastic, it's no big deal. And when they go on to have these procedures without any apparent problems or risks, to those who are on the other side and who are trying to become influencers, they think, well, if she can do that, so can I. And wow, the benefits, because it equates to more attention, and more attention leads to more followers. And that, by no means am I denigrating anyone. I'm not criticizing Destiny for making the choice that she did. I'm not criticizing Shinad for making the decisions that she did, because they're both adults. They can make their decisions. Yes, they can be influenced, possibly unwisely, by certain things that they see. And so there should be some responsibility in that direction. But at the end of the day, they've made their choices. And sadly, Destiny isn't here to tell her story. But I will say that BBL, Brazilian butt lift, is one of the most dangerous forms or types of cosmetic surgery.
We're talking about buttock augmentation. Much of the time we're referring to adding more volume to the backside and giving it a better shape, sometimes called the Brazilian butt lift. The procedure often involves taking a person's own body fat and adding it to the buttocks. This usually means taking fat from what is called a donor area, which is often either the love handles, the thighs, or the stomach. But it could also mean putting synthetic implants into the backside, something that carries more risks and is very rare in the USA. What kind of people go for such surgery? One plastic surgery website tells us these people are worried their butt is too small, feel their butt isn't round enough, or that one side is bigger than the other. They have an asymmetrical posterior. It's also advised that if you opt for this surgery, that you should be in good health, not smoke, and it's better if you're committed to living a healthy life. What about the cost? The American Society of Plastic Surgeons tells us that in 2017, the average cost of a butt lift was $5,113. The average cost of a butt enhancement with fat grafting augmentation was $4,096. And the average cost of getting butt implants was $4,884. It goes without saying that if you opt for the cheapest butt surgery out there, you might be putting yourself at risk. People are asked to check if their surgeon is qualified, experienced, and certified.
I know enough about the data and I know enough about the description of the procedure, how it can easily end in disaster for somebody who is not skilled in carrying out the procedure. And even if they were, if you were left in the care of people who don't know how to manage or recognize early warning signs, how easily things can just go to just tragic proportions as they did in the case of Destiny.
The list of complications of butt surgery is a long one. These include infections, bleeding, pain, poor healing, fat necrosis, deep vein thrombosis, cardiac and pulmonary complications, accumulation of fluid, asymmetry of the butt, numbness, scarring, skin loss, and more. That's pretty scary. So now is the right time to tell you about when butt lift surgery went very wrong, when the complication was the worst on the list: death.
I think the painful thing as well is that we're having these procedures in countries like Nigeria, where you have very, very weak infrastructure and weak regulation. And I want to call out people who would advertise a procedure that has serious medical complications and sweeten the deal so that people are attracted and waive any possible cautions because you've got a sweet deal. So you give it at a discount, or you give it 50% off or whatever percent off. And by so doing, you ensure that they're not asking the right questions. They're not checking and doing the triple checks that they should before going ahead, especially in a country with weak regulatory systems and weak healthcare infrastructure, where you can't get an emergency ambulance to respond to you in a timely fashion, where you may not even be able to get adequate medicines to treat potential infections, where you don't even have staff that can monitor and recognize signs of deterioration before they escalate to where things are irreversible. How do you do such things? I really want to call that out. And that's why I'm putting this video out here, because we've got to make a statement. Again, as a young woman, it's your responsibility. It's your life. I can't tell you what to do. We simply can't say it too many times. And for those that will listen and decide, okay, based on this information, I'm going to be very careful and I'm going to resist the temptation or the trap to go down that route because somebody looks fine, because they've sculpted their shape and they've enhanced their figure. After a while, the chickens are going to come home to roost. Remember that many of these celebrities are going to reverse these procedures. So maybe they've stuck with them for a few months or years and something has started to happen and they realize that actually this is not what it was cut out to be. You probably won't hear that side of the story.
One source tells us that Brazilian butt lift surgeries in the US have been getting more common over the past 5 years. It also tells us the American Society of Plastic Surgeons, the Brazilian butt lift, or BBL, has the highest rate of death of all aesthetic procedures. Why is that? We're told that injecting fat into the buttocks is not exactly the safest of procedures. This is because the fat is injected into the muscle, not just other fat. If it goes into the muscle, it has more chance of staying in place. But this is where the problem lies. Apparently, injecting fat into muscle can lead to complications if not done correctly. What can happen is something called fat embolism, which means the fat gets into the bloodstream and blocks a vessel. This could mean blocking oxygen getting to your lungs or to the brain. and that could mean game over for the patient. But how dangerous is it really? The Aesthetic Surgery Education and Research Foundation, or ASERF, set out in 2017 to find out the answer to that. It interviewed 4,843 plastic surgeons globally and also looked at data when possible. 692 surgeons responded to the survey and in all reported 198,857 cases of gluteal fat grafting. ASERF wrote, over their careers, surgeons reported 32 fatalities from pulmonary fat emboli, as well as 103 non-fatal pulmonary fat emboli. 3% of respondents experienced a patient fatality, and 7% of respondents reported at least one pulmonary fat embolism in a patient over their careers.
If you're lucky, if you've gone ahead to have a BBL and you're lucky to avoid complications like death or serious complications like infections or chronic pain and so on, you're lucky. That's all I can say, that you're just lucky. Specialists consider this to be the most dangerous cosmetic procedure. How do you hear that and decide or choose to go and have it in an environment where regulation of healthcare is not 100%? You're simply putting your life at risk. You're simply giving your life to somebody who will not care, who will move on, who there is no accountability, so that we don't even know exactly what happened. We can't even say, let us conduct an autopsy and find out conclusively without any mago to find out what actually happened. I'm sorry, but I just I just feel so strongly about this that, by records could be doctored. We have no way of auditing the information. I'm just saying to any young woman out there who is considering BBL, please stop. Please stop and think about it, and think about it again, and think about if it's really worth it. Because this young lady who died, and so many others who have lost their lives or suffered complications as a result, had their whole lives ahead of them, had everything else going for them. And like somebody said, this is not a sickness. It's not that somebody was ill and then they had to go into hospital and then became the victim of poor medical care. They willingly handed themselves over to a scenario where healthcare at its best is of very low quality at its best. You don't take those kind of risks with your own health. You don't.
A doctor talking to the BBC estimated that 1 in 3,000 people die when receiving this treatment, which according to the website Injury Facts is about the same odds a person has of choking to death on food in their lifetime.
And there's some girls out there who, despite having complications, say they would still go through it again, because our society allows value to be placed on extreme appearance, like somebody who's gone ahead to have her body sculpted from a BBL. So I don't want to say too much on this. The purpose for shooting this video is to lend my voice to the conversation, to say to you, if you're thinking about having a Brazilian butt lift, stop. Think about it. Think about everything else that you have to offer.
So let's say you're not one of the people that died. Does it mean that you're home free? Not according to reports. There might be significant trauma to come. In 2018, a 23-year-old woman from Wales said she had also skipped over to Turkey to get her butt done. She didn't die, but said months after surgery, holes had formed in her backside and it was leaking. I couldn't walk properly for ages, she told the BBC. Adding to that, the leaking fat would make a mess of her clothes. She said it smelled bad and she had to bandage her butt all the time. I honestly wish I could go back. I was happy with my body before, and now I paid a stupid amount of money to look like this, she told the BBC.
Don't get carried away by the social media bubble. Just because somebody had this procedure and it went okay for them does not mean the same for you. Please don't allow your life to be treated as if you meant nothing. Please don't do this to yourself. I make this appeal. You're beautiful as you are. You're gorgeous as you are. The demands of a culture and the demands of a world should not be why you push yourself in a direction where you potentially could lose your life.
If you want to give yourself a shock, just look at the pictures online of when butt lift surgery, often with implants, turned bad. Not only is the butt a mess with holes all over it, but some of these photos look monstrous, as if the butts were fashioned with plasticine by a kid that was very bad at modeling. It's unfortunate that some people are so insecure in their behind that they take such a risk. Perhaps we're not all born to be able to take the perfect belfie. A consultant plastic and cosmetic surgeon at the Plastic Surgery Group told the British media that there are sometimes complications, but often surgeons just get it wrong. He said that if you must get it, avoid fillers and choose your surgeon wisely. If you don't choose wisely, you could end up looking much worse than before, and as you know, you could die. Never go for the cheap option.
Let me know what you think about BBL and going ahead to carry out this procedure with all the information that we already know that it could cause. What is it that drives girls? I think the answer is clear. The only thing that we can really do is about strengthening regulation and making women ask the right questions. And what are those questions? If someone has to carry out this procedure, ask the surgeon, how many of these have they done? Show you before and after photos. What quantity of fat are they going to remove from your abdomen or your thighs to put into your bottom for the sculpting? What kind of aftercare are you going to have? If an emergency happens, what will they do? What's their process? What's their procedure? And please don't be carried away by discount healthcare. Come on. If it's discounted, it smells. If it's discounted, it's fishy. It's a highly specialized procedure. Only people who've had the right training can go ahead to do this properly. Think about it. Fat is being removed from one part of the body and injected into another part of the body. Your buttocks already have lots and lots of blood vessels. Blood vessels. So imagine somebody who doesn't know what they're doing, whose anatomy is not sound, trying to inject the fat gathered from the other areas wrongly into a blood vessel in the buttock. And I know there's an alleged report circulating claiming that the deceased had a scan and no signs of fat embolus were found. Allegedly, I don't know. But the fact is that fat embolism, which is when fat gets into the blood vessel and then travels in the blood vessel towards the heart and towards the lungs and quickly can result in a pulmonary embolism, is one of the most common complications and causes of death following BBL. Other complications can include infections. So there are so many things that can go wrong from BBL. Please watch it. Please be careful. Thanks for watching. I'll see you again soon.